Hello everybody, thank you for joining my presentation. My name is Jared O'Connor, and today I will be discussing cholera outbreaks in Kenya, a global health equity proposal. So beginning with the introduction tile, Kenya, a lower middle income country in Eastern Africa, continues to face recurrent cholera outbreaks across many counties. Cholera is a diarrheal infection caused by an individual ingesting food or water that is contaminated with the Vibrio cholerae bacteria. This illness often presents mildly, but can turn severe and even fatal if left untreated. Countries like Kenya are often disproportionately affected by cholera outbreaks due to their limited resources, highlighting systemic global health and socioeconomic inequities. An outbreak beginning in February 2025, primarily in 3 counties, has led to 256 suspected cases and 13 deaths. So this leads to our problem statement. Insufficient access to hygiene infrastructure, sanitation services, and medical treatment measures in underserved regions in Kenya is driving cholera outbreaks with high fatality rates. So now looking in the bottom left-hand corner, 3 contributing factors that give way and exacerbate the current problem in Kenya are insufficient wash infrastructure, health system limitations, and poverty. So beginning with WASH, this stands for Water, Sanitation, and Hygiene. This is severely limited in many regions in Kenya. In 2022, only 31% of the population consistently used safely managed sanitation services. 38% used hand washing facilities, and only 11% of wastewater flows were safely treated. Access and delivery of public health resources for Kenyans is also scarce. Having 1 doctor per 5,725 Kenyans limits the ability for the population to access cholera treatment, such as oral rehydration therapy and antibiotics when needed. Even in areas around the country where healthcare services do exist, 78% of them are unable to offer critical care, and 93% of them are unable to provide basic outpatient services. Lastly, in 2021, 38.6% of the population, which is about 55 million people, was at or below the national poverty line. High poverty rates combined with significant overcrowding promotes environments that are ideal for the transmission of cholera. So this transitions to our proposed intervention, which is an evidence-informed intervention that addresses health equity related to cholera. And this is the strategic use of the oral cholera vaccine. The rapid deployment and administration of vaccines can play a critical role in both preventing and controlling cholera outbreaks, especially in low-income countries such as Kenya. So while long-term efforts are focused on wash techniques, improving infrastructure, vaccine campaigns can serve as rapid and cost-effective interventions that reduce mortality and mitigate health disparities quickly. So completion of a 2-dose series is about $2.98 per dose from the World Health Organization's global stockpile, and this offers effective cholera protection with approximately 3 years of protection for an individual after the 2-dose series. So this leads to the Sustainable Development Goal that's tied in with this intervention. So this proposed intervention aligns with Sustainable Development Goal number 3, which is ensuring healthy lives and promoting well-being for all at all ages. In particular, SDG Target 3.3, it aims to end various communicable disease epidemics, including waterborne diseases such as cholera. Now looking in the bottom middle section of the poster, to plan and implement this intervention, cultural influences and traditions should be addressed. First, building rapport with key community leaders and stakeholders will promote trust and working relationships between all parties involved. This will be a great time to discuss and address any socioeconomic and cultural factors that will play into the intervention. So for example, a 2012 study in Western Kenya discovered while nearly all residents would take a cholera vaccine at no cost, this acceptance greatly regresses when the vaccine is offered at different prices. So because of this, ensuring the vaccine is offered either free or as inexpensive as possible will be essential for a successful intervention. Moving to the upper right-hand corner of the poster, just a few of the many public health professionals that will be needed are epidemiologists, program managers, and community health workers. Epidemiologists are on the front lines of cholera surveillance and risk assessment, mapping hotspots and analyzing transmission patterns from the outbreaks. Program managers, they will be responsible for the oversight and just overall coordination of the vaccine program. And lastly, community health workers will serve as key public health professionals who can engage with high-risk populations, provide education, and actually administer the oral vaccine to the population. Along with professional members, there are also going to be 3 global health partners needed for the planning and administration of this intervention. So first, the International Coordinating Group on Vaccine Provision is a global health partner created by the World Health Organization. They are responsible for managing and deploying the global oral cholera vaccine stockpile. Secondly, Gavi, the Vaccine Alliance, is a public-private organization who funds the global stockpile and supports supply logistics for getting them to these countries. And then the third and equally as important partner is the community itself. So while they are the intended recipients of the intervention, a successful campaign will also require their engagement throughout the entire process, planning, the actual administration, and evaluation. So that leads us to evaluation. Of the many, many possible evaluation methods, two possible methods that can be used for evaluating includes changes in disease rates and health equity analysis. So first, having a measurable reduction in new and existing cholera cases in outbreak areas will help determine the effectiveness of the intervention regarding disease transmission. Additionally, ensuring the vaccine reaches all populations within the community, such as low-income and rural ones, will demonstrate success in promoting equitable access and outcomes. So now moving into the bottom right-hand corner of the poster. Just reflecting on this process, this highlights my public and global health passion for prevention, disease mitigation, and the reduction of health disparities. Being able to do this by planning culturally relevant information interventions is something that aligns with my career interests, especially in the field of public health emergency preparedness. So thank you for listening to my presentation, and please feel free to reach out if you have any questions. Thank you.